Okay, time for our weekly conversation with Dr. Isaac Bogosh, infectious diseases specialist at Toronto General Hospital. Dr. Bogosh, always appreciate the time. Thanks for being here. So let's kick it off with this. A few days ago, there was an RSV vaccine for seniors approved in this country, but the Public Health Agency of Canada also says it will likely be kind of limited availability for this season. And the NACI, the National Advisory Committee on Immunization, says it's not expected to issue guidance on the RSV vaccination for older adults until 2024. So what's going on here?
Hard to say. I mean, for starters, I think the first step is that Health Canada has approved the vaccine. So step one, it's essentially allowed to be used in the country for vaccinating seniors against an infection that, of course, we know brings seniors into hospital because it can cause pretty significant illness, including hospitalization. So that's the first step. But of course, the second step is we need a playbook in terms of how this is going to roll out. And NACI usually opines on this. So, obviously we're going to have to wait till 2024, even though there's a limited number of vaccines and it's not entirely clear what exactly that means. We will still probably have some in the country, and that will just mean that the provinces will determine how this will be rolled out based on the limited amount that they get. And, obviously it's hard to know what the details are, but you can imagine that they would prioritize the highest of high-risk individuals first. And we know who that is, right? These are the people who are on the oldest end of the spectrum, people with underlying medical conditions that put them at greater risk, people who live in long-term care facilities where we know there's RSV outbreaks from time to time. It's probably going to look something like that. Having said that, listen, this vaccine is coming through the pipeline. The phase 3 clinical studies look very, very good and very, very helpful. But just like we saw with COVID-19 vaccines, we got to see how this rolls out in real world settings to really understand the true effectiveness, and also to see if there's any rare side effects that just didn't show up in large clinical studies that involve tens of thousands of people. So we'll learn more about this as it rolls out.
Absolutely. Speaking of COVID-19, it's kind of been quiet on the sort of COVID front, at least in terms of what we've been seeing lately. I'm sure from you it's a little bit different perspective. But I saw you over the weekend, you were on talking about the variant EG5 that's emerging, not necessarily too prevalent right now, but you're expecting it to sort of gain strength or sort of, infect, I suppose, more people here in the country. Now, what do we know about EG5? What's different here? Because there was a story a couple of weeks ago about if you were infected with, a certain variant that perhaps you may have some protection as well.
Yeah, absolutely. I mean, EG5 is another sublineage of Omicron. So this is all under that Omicron umbrella. And I think the scenes that we saw in 2020 and 2021 and very early 2022 hopefully are days past. And we can likely expect something similar to what we've seen since the spring of 2022 onward. The virus continues to mutate. We see it waxing and waning and waxing and waning. EG5 we see is another sublineage of Omicron. We see it starting to take over in certain parts of the United States and the United Kingdom and other places around the world. It's going to spread. We know that's what happens. And it'll likely have a wave similar to what we've seen much more recently. So sadly, some people are going to get sick. Sadly, some people are going to end up in hospital. Sadly, some people are going to succumb to this illness. And of course, we have to protect everyone, but this is probably going to disproportionately impact more vulnerable individuals, people who are on the older end of the spectrum, people with underlying health conditions that put them at greater risk for severe infection. Hey, it's not new anymore. We know what this is. We know how to protect ourselves. You can lower your risk by putting on a mask in an indoor setting. You can be up to date on your vaccines, and we know there's going to be vaccines rolling out again in the fall of 2023. We can improve the air quality in indoor settings to reduce the risk of transmission in indoor settings. You can stay at home if you're sick and not send your kids to school if they're sick. So we already know what to do. And I think this is going to be a little bit more of the same compared to more recent waves where, yep, sadly, it's still a wave, but it doesn't, for example, overwhelm our healthcare system like earlier waves did in the pandemic.
I remember you once mentioning wavelets. Sort of smaller waves almost. So there's sort of that blip there. I remember even a couple of months ago, right, it seemed like there was like this, people were just kind of getting it at a point here. In terms of, with EG5 around and with COVID generally speaking, I mean, you're seeing more than what, of course, the average person is seeing. What's the level kind of concern right now? I mean, you just outlined all the different ways we can protect ourselves with it, but from where we were to where we are, what's the kind of perspective now?
I mean, obviously, it's a much different era now versus 2020 and 2021. Having said that, we're all coming from different places. And we're living in an era where there's no mandates or restrictions or anything like that. So people will choose what level of protection they feel is best for themselves and their family. And of course, they should be making informed choices. And of course, people might be choosing different paths based on their individual circumstances and also their own level of risk perception. So, some people might live at home with a vulnerable individual or have an elder parent or grandparent at home or someone with an underlying medical condition, and they might be masking religiously. Kudos to them. Other people might say, you know what, we've had this infection, we've been vaccinated, I'm choosing not to mask in those settings. And again, I think we just have to be respectful of people's choices, but especially remembering that there are vulnerable people among us, and we should be protecting them, and we should be making sure that we have safe indoor environments.
All right, we'll leave it there for this week. Then that is Dr. Isaac Bogosh, infectious diseases specialist. Again, always appreciate the time. Have a great week.
Be well. Thank you so much.